So, with all of the pressures and concerns around COVID-19, people are actually not seeking support for kind of health issues at their primary care services and even secondary care services that they might have been going to due to kind of various fears and perhaps not knowing that the services are still open and adapted during these times. And also, in terms of mental health care seeking, referrals have dropped to the primary care mental health network services. So I guess one key thing to highlight is that a lot of these services are still open and taking referrals, and people should feel free to still seek the support and ask for it if they need it. And just to kind of reiterate some of those support services for helping with stress and mental health. So there is the improving access to psychological therapies, the IAP services across the UK that are still open, and all therapy has been adapted so that it's over the phone or via videos. So those are still taking referrals and ready to help people there. There's charities such as the Samaritans to always reach out for if you need support. It's not just when you're in a crisis, if you just need to kind of process things or talk to someone. And of course, there's other charities as well that you can look into. And there's been kind of increase in resources for various charities, so it's worthwhile checking those out on Google. Also, just having a look into resources that are available to you at work, perhaps more peer support initiatives, or there might be other initiatives to help support staff. So really trying to check out what's available there. And if there are difficulties in the workplace due to COVID issues in terms of feeling kind of discriminated against if you fall into one of those high risk categories, there are employment services that can give you guidance. So there's one called ACAS, ACAS. And if you just put acas.org in, you can get some advice specifically around that. And also just remember that GPs are still open and taking remote referrals, remote appointments, and then they'll triage and see if you need to come in. So do make use of your GP services. Would you add anything there, Susan?
Yeah, no, I think it's just a really important point to acknowledge that both physical and mental health care are still just as important than they ever were. And it's really important that people feel that they have a right to kind of access those services if they feel they need them. Yeah. And while the focus might really be on COVID at the moment, and we might be focusing on symptoms that are related to COVID, there might also be other symptoms, whether it's kind of like you say, mental health or physical health, where people might need support. And if you're experiencing anything to do with like a physical illness or a mental health issue, do reach out and seek support, because the services are open and it's as important as ever to be able to do that.
Yeah, absolutely. And outside of using services, what kind of things would you encourage people to do to try and seek support?
Yeah, I think that's a really good question. And I think it's an interesting one, because I think at the moment, we can all be very aware that everybody's going through a difficult time, and everybody's kind of going through a similar experience, which is quite unique, I suppose, in what most of us will have experienced in our lifetime. And I think while that can be helpful in that we're all sharing an experience, it can also perhaps hinder people seeking support when they need it. Mm-hmm. But I think it's more important than ever to establish connection between you and other people, whether it's people who you live with, if you're lucky enough to live with people at the moment, or family members or friends. And we're going to have to be creative in terms of how we do that. So it will probably be through phone or kind of through digital means, but just making sure that you do reach out and connect with people. If you're in work, I think connecting with colleagues and acknowledging the stress that you might both be feeling is really important. And then, yeah, I think in the ways that we support each other, there's obviously checking in with how people feel emotionally and kind of supporting with shared stress or anxiety. But there's also kind of making sure that you still take time to appreciate like humorous moments. And we're probably all getting WhatsApp group fatigue from all the different things that have been shared, but actually it is a reminder to kind of acknowledge the lightness in a dark situation and be able to kind of, find humor where possible and reach out to people that way.
Yeah, absolutely. I think that's a really important point. Sometimes it might not be that we need to reach out for really serious conversations, but just by having a joke with someone or sharing some kind of silly memes or whatever it might be can really help us feel better without having to have gotten into anything really heavy. So yeah, it's worthwhile kind of trying different things that work for us across the different mediums,
Exactly.
different groups. Yeah.
Yeah, just about kind of, I suppose, staying connected, even if we have to be physically isolated.
Yeah, absolutely. Great.